As the world marks Tuberculosis Day, the Health Department is launching the End TB campaign as an initiative aimed at encouraging testing. South Africa has one of the highest TB infection rates. In 2023, there were 270,000 new cases recorded and 56,000 deaths. To discuss this, I'm now joined by the Minister of Health, Dr. Aaron Motsoaledi. Minister, very good morning to you. Thank you so much for joining us this morning. World TB Day in 2025 also takes place under very difficult circumstances, considering the funding that has been cut by the United States. And now also we're hearing over the weekend that funding by the NIH to various universities for research in HIV and AIDS as well as TB has also been cut. What's your reaction to this, Minister?
Well, it's not good news at all, Aldrin. Good morning, and good morning to the listeners and viewers. It's not good at all, not only for us, I must say, but for the US itself, because the research that has been done in South Africa is not only benefiting South Africa or Africa and the poor world. It's also it's going to affect the US, because a lot of research which enabled US pharmaceutical companies to produce drugs, because to tell you the truth, because of their economic power, they are the ones who do a lot of research on originator drugs before the rest of the world, especially India, start producing generics. So if there is no research, there will be no new pipeline, even in the US itself, about production of originator drugs. So it's a loss-loss. It's not a win-win or a win-loss. It's a loss-loss for the world, for South Africa, and even for the US itself, unfortunately.
What would you say the immediate impact of such a decision would be, especially on the National Institute of Health from the United States cutting its funding research or research funding? The South African Medical Research Council Chief Scientific Officer, Professor Glenda Gray, quoted in the Business Day this morning, estimates that around $250 million per year comes from the NIH for medical research through direct and indirect awards. What would you say the immediate impact of this would be?
Well, I can only talk about the long-term effect of no pipeline of research. At the moment, I'm not able to see the immediate impact, because the immediate impact will have been stopping treating people with TB and HIV and AIDS, which we are not doing. As you know, on the 25th of February, it was 3 weeks after the announcements start flowing in, because they came differently. We launched a project at Chris Hani Baragwanath Hospital and Lillian Goy Community Health Center. We launched a project to look for 1.1 million more people to put them on ARVs, because we already have 5.5 million people who are on ARVs. We are adding, and we think by December, we should have reached those numbers. Today, the Deputy President in the World TB Day here in KZN is launching a project called NTB campaign, whereby we are planning to look and screen and test 5 million people every year for TB and put them on treatment. So in that regard, we are still going on. But on the field of research, it is definitely the area where the pipeline will start drying up. And as I'm saying, I'm repeating, it's not good for anybody in the world, even for US itself.
Yeah. Then speak to us about the ability to plug that hole. So the poll that we're running this morning, we're asking our viewers, how can South Africa raise the funds for HIV and TB research after the US decision to cut the grants? We have 3 options there: engage multinationals, the private sector funding, and pull from our own resources. But as we currently know, and even if you look at the current budget that was tabled, we already have a constrained budget. So where will we find the money to plug the hole? Because yes, it's one thing to say that this decision will also impact the US, but it will also impact us as a country. Where do we plug the hole, and how do we plug this hole?
Indeed, Aldrin, you may remember that there was a debate in Parliament sponsored by the leader of EFF, Mr. Julius Malema, about this issue of cutting funds. You'll remember what I said, and I wish to repeat it. Number one, that Trump doesn't owe us any cent. But number two, that South Africa is already spending a lot on health, more than many countries. We're spending 5.8% of the GDP on health, whereas the recommendation from the World Health Organization is at least 5%. We've already exceeded that. We are spending 570 billion. That's R500 billion. The money that Trump has taken away from us, as we heard, is for HIV and AIDS is 7.8 billion. But we're already spending 570 billion. And what does that have to do with anything? It is because the manner in which that money is distributed in South Africa's unequal society. Let me say grossly unequal society, because 51% of that money is spent only 14% of the population. These are the people who are on medical aid, and they are mostly well-to-do people who are being subsidized by the government for 70 billion rand to sit on those medical aids, and an additional 33 billion rand, which is tax rebates given to anybody who has joined medical aids, regardless of who are working for. I put a challenge to Parliament that these are the things we need to discuss to be self-sufficient. It is called universal health coverage, or NHI in South Africa, which many people decided to fight against. It was meant to make us self-sufficient, and I still believe we can be if we take the money that is already being spent and spend it equitably between the rich and the poor, because at the moment, it favors the rich, like me and you who are on medical aid. And unfortunately, the people I'm talking about when I say the rich are the cream of the nation. It is people who are on medical aid, as you know, are teachers, are nurses, are police, the army, members of parliament, everybody working for the state earning about a particular salary, the judiciary, magistrate, everybody who has got a title are the ones who are being subsidized. And the problem that has happened about the cutting is going to happen to the poor. So if we can sit together and say we are one nation, let us help each other, I believe we can solve this problem.
Yeah. Last week, Minister, you also spoke about TB and the impact that it's having on the country. What would you say the most urgent needs are for the nation to also meet the goals that are going to be set this morning by the Deputy President?
Well, it's for us to sit together as a nation and agree that we're ending TB. That's why the slogan here is me and you can end TB together. So it's for us as South Africans and for us to understand what is the meaning of this looking for 5 million people. This is what's going to happen, Aldrin. We're going to make sure that in every family where somebody tested for TB, the whole family must get screened and tested. We must make sure that they are free of TB or not, because it can be transmitted from one person to the other. We also want to say anybody who has got who is HIV positive must be tested for TB, because the two diseases fit into each other. We also want to follow up people who have had TB treatment to see that it does not come back to them. And we need to encourage everybody who's on TB treatment not to stop taking treatment, because we have found out that many people, once they take treatment and become better, not cured, because TB is definitely curable, but once they feel better, they no longer have symptoms, they tend to stop the treatment, and that's one of our biggest problems.
All right. Minister, just quickly on two current affairs-related matters. First of all, the matter around cannabis. We see that one of the associations are saying that they will be taking the minister to court around the regulations that have been gazetted on THC as well as CBD-infused foodstuff. What's the minister's reaction to this? Because the point that they are stressing as well is that there wasn't adequate consultation.
Well, I will respond to them, Aldrin, because we have received quite a number of letters. Some have been written to the president. The president has told me that we are going to sit down. I'll prefer not to respond to them through the media, unfortunately. We will, at the appropriate time, call a press conference and announce what we do about this issue. But for now, please allow me not to answer to individuals through the media. Okay. It won't look very decent.
All right. Would Minister then be able to speak around what the idea around the regulation was, what the department was trying to achieve?
I'm actually trying. not to do that, Aldrin, if you allow me, because we'll explain everything in a media conference after. The reason is that, as I said, President has already given me a notice that we're going to sit down and talk. And I don't want to shoot my time before I know exactly what the president is going to say and what the outcome it will be. Please forgive me for that. You just have to wait for a few more days.
Okay, but does that mean that that gazette remains in place as it stands, that the ban itself remains in place up until after that meeting?
Well, all I can say, Aldrin, is that I've seen even letters complaining about something that we did not ban. What we did there was specifically for food and nothing else. No, that's all I can say, not medicinal or industrial. There's nothing like that in the regulations. And please allow me to stop there. It was only about food because we're worried that young kids are consuming this food and we've already got evidence of what happens to them.
All right. And then the final one, Minister, in the next few minutes, we'll be in conversation with the Health Portfolio Committee for the KwaZulu-Natal Legislature, Dr. Imran Kika. One of the concerns that have been raised in KZN, and of course with the budget constraints as well, is the availability of medication or also the low stock of medication. Is this a major problem that's experienced in other provinces at all, or is it just a KZN issue for now?
I think the issue of shortage of medication is usually a facility-based, province-based or district-based. It all depends on whether people afford that. Let me give you a good example, Aldrin. We always hear about shortage of ARVs in facilities, in clinics, and even in some provinces. But we, for ages, have been having buffer stock. We take HIV, AIDS, and TB so serious that we don't want to run out of stock. We do have buffer stock, which is held there at head office in case there's an emergency somewhere, like shortage of production around the world. So the things they are talking about is usually logistics. And we need to visit those facilities and find out what went wrong in their logistics to run out of drugs that otherwise exist in the country.
All right. Thank you so much for that explanation. Dr. Aaron Motsoaledi is the Minister of Health there.